to represent fellow classmates, my formative partner Diarshan and myself Nanika, and my opponents Gitika and Sharina, will be debating the resolution, be it resolved that the urban healthcare is equitable in public sector facilities. Urban healthcare delivery is equitable in the public sector facilities. Healthcare is one of the leading problematic trends in the public sector. Urbanization is the gateway to a better life. There are many job opportunities, better healthcare, improved standards of living, and more resources available. Health is a key challenge and needs plenty of attention, because if the population isn't healthy, how can a country progress as a whole and become economically developed? Therefore, all citizens need to ensure a healthy living. Globally, can be seen that there is a very big imbalance in the healthcare provided. Many countries receive excellent healthcare as they are economically developed as a country and can afford all these special healthcare treatments. Whereas on the other hand, there is underdeveloped countries which are still battling to fight this challenge and are hoping for government to take action. Healthcare is one of the biggest issues and are still not fully addressed, be it globally, locally, or regionally. With modern science and technology, healthcare is improving. There are better means of undergoing surgery, many processes are not painful and are much more advanced. Globalization is the key challenge to public health, especially in developing countries. But the linkage between globalization and health are complex due to the economic situation. Health systems and global trend depend on equitable access to healthy systems that delivers high-quality services. The services that are rendered depend on the country's context, such as adequate financing with pooling of risk, dedicated workforce, plenty of information on the policy and management decisions, logistics for medicines and technology, excellent networking processes, and well-maintained facilities. Global health as an endeavor has expanded strikingly over the past 2 decades and offered great promise to improve lives in resource-poor settings. Broad public interest in the health and well-being of people in the developing world and of poor and marginalized individuals in advanced economic has grown. The public sector covers most of the population, particularly 68% who do not use any private care. Government spends about $1,900 per person on this group. The group of South Africans who are completely dependent on the public health sector is 4 times larger than those who are cared for entirely by a private health sector. This clearly indicates that the public sector is one that provides for the citizens. In 2008, 16% of the population was covered by medical schemes and were able to secure most of their health service in the private sector. For this group, about $11,300 is spent per person. This includes both medical scheme spending and out-of-pocket payments. As a result, many individuals have to pay a lot for medical care, whereas, on the other hand, public hospitals catered for all requirements of an individual, be them poor or rich. The main aim of the public health care department is that they have no eye on the profit making, and they are open to everyone, rich or poor. They cannot turn away from any patients because they treat all patients as equal citizens. The public sector is there to help. Even though the public hospitals are mostly overcrowded, they will ensure that you have been attended before the end of the day. The priority of the government is to improve the health status of the entire population, and its main vision is to contribute the long and healthy life of all South Africans. In accomplishing this vision, there are 4 strategic outputs that the government has identified, which the health sector must achieve. These are to increase life expectancies, decrease maternal and child mortality, combating HIV, AIDS, and decreasing the burden of TB. Health is a universal human aspiration and a basic human need. The development of society, rich or poor, can be judged by the quality of its population's health, how fairly health is distributed across the social spectrum, and the degree of protection provided from disadvantage due to ill health. The time for action is now, not just because better health makes economic sense, but because it is right. The outcry against inequality has been intensifying for many years, from country to country around the world. But what is needed is excellent healthcare that every citizen benefits from. Every country should try their level best to ensure that every citizen has fair health.
Inequalities in healthcare currently is most important complication to development. Such disparities are deeply offensive, more so than economic and social inequalities to which they are related, with their elimination presenting a major focus on public health policy. South Africa, like almost all other countries, has committed itself to ensuring equitable access to healthcare. The socio-economic right to healthcare is entrenched in a number of human rights instruments to which South Africa is signatory, including the Universal Declaration of Human Rights, Section 25, the United Nations Covenant on Economic, Social and Cultural Rights, Section 12, the African Charter on Human and People's Rights, Section 16, and a range of other international conventions. South Africa's own constitution also makes reference to people's right to healthcare in Section 27, which states that everyone has the right to have access to healthcare services, including reproductive health care. Furthermore, in 1977, the World Health Organization endorsed a global strategy of health for all by the year 2000, which was reaffirmed in the 1978 Declaration of Alma-Ata. As such, disparities in health represent an important yardstick to progress towards development. The current debate is on countries moving towards universal health systems. However, this requires a holistic understanding of equity in both the delivery and the financing of healthcare for both the public and the private sectors, highlighting that urban healthcare delivery is inequitable in public sector facilities and individuals are better off with private health sector facilities. Taking into consideration the vast concerns of healthcare delivery, my partner and I will focus on the usage and problematic issues health services demonstrated by the public sector as a whole, identifying that urban healthcare is not equitable in public health sector. Many African countries still do not have equitable health systems. This shows that regional developing countries are in the state as South Africa, if not worse. Usually, equity in the delivery and the financing of healthcare are assessed separately, which may be termed as a partial analysis. The number of studies combining these aspects to date is limited, especially in Africa. An assessment of overall health system equity involves assessing healthcare financing in relation to the principles of contributing to financing according to ability to pay and benefiting from health services according to need for care. Currently, South Africa is considering major health systems restructuring towards a universal system. This shows how South Africa is trying to use ideas from other countries which can have serious repercussions. Healthcare is delivered through both private and public sectors. A large fraction of the population is dependent entirely on the publicly funded system for healthcare, while private funded covers only those who can afford to pay. Private healthcare consumers are over 50% of total healthcare spending in South Africa, but is inaccessible to most of the population and in many cases highly inefficient. Nevertheless, many, if not most, South Africans rely on or aspire to private sector healthcare. Evidence that the poor often benefit less from public spending is well established. The reason why the poor do not make more use of public services is driven by both supply and demand factors. The report on macroeconomics and health reinforced the need to overcome the substantial barriers to access that exist for the poorest. The focus of much health policy interventions has been on reducing supply barriers. Delivery of essential services concentrates on improving the quality of staff skills, protocols of treatment, availability of supplies, and environment of health facilities. Yet while these interventions are important, they do not address many of the barriers to accessing services faced by a patient in a low-income country. Whether and where to go for treatment starts well before arrival in a facility and requires a myriad of complex and potentially confusing choices to be made. Often health services of a reasonable quality exist, but few use them. Just as important are the physical and financial accessibilities of services, knowledge of what providers offer, education about how to best utilize self and practitioner-provided services, and cultural norms of treatment. The different operational motives of the public and private hospital sectors contribute to differences in the size and location of public and private hospital establishments, as well as in the services they provide and patients they treat, hereby elaborating on some key differences between the public and private sectors in the context of the hospital system as a whole, while also recognizing their similarities. Core differences in the operational incentives, roles, and responsibilities of the public and private hospital sectors highlight the complexity of directly comparing the sectors on the basis of efficiency. Indeed, studies have confirmed that efficiency may not be the primary objective of all hospital providers, and that some explicit objectives of the public sector, the delivery of emergency care, equity of access, and clinical research and training also contribute to the overall quality of the healthcare system which is provided in the private sector. Hospital performance may not be the greatest priority in the objectives of certain groups. State administrators have different priorities to hospital managers, who may not also be clinicians. There are also equity considerations and many other issues such as the capacity, which must be held back when running an emergency department, as well as staff commitments to teaching and medical research, all critical components to a highly quality healthcare system, and again reducing comparability of providers. Given the complexities involved in assessing the comparative performance of the two hospital sectors, this debate acknowledges that points of similarity with identified factors by which the sectors can be appropriately compared, highlighting that yet again private healthcare facilities are way better and responsible than public healthcare facilities.
Equalities in public and private health.
Okay, just hold on a minute. You guys have got to be engaged in the audience. There's too much reading going on. Okay? I'm just trying to, now that you still have a little time to do something about that. Just engage us.
Qualities in public and private healthcare in South Africa differ drastically in many ways. In South Africa, there are many people who use more public healthcare facilities than in the private sector. The public healthcare facility caters for more than 50% of the South Africans. And this proves that the public sector has the facilities to cater for this large amount of people. The public health facilities assist the elderly with their medication and so on, as we see in our various hospitals, and also provide free health checkups and help them slowly stay alive and healthy. The public health care, they also cater for pregnant women and mothers who have given birth and offer free health solutions to them for the babies for up to 6 months. These initiatives are great in the sense that you can see that the public sector is actually doing something to help the generation. As you know, there's that younger women at ages of 15 are having babies as well, and they obviously cannot finance themselves. The National Health Insurance is a financing scheme that will make sure that all citizens in South Africa are provided with the necessary health care, regardless of their employment status and ability to make direct monetary contributions to this fund. There needs to be an improvement in the quality of service in healthcare, yes. So at the moment, the Department of Health is investing in infrastructure which is deemed critical in both buildings and facilities. The Department of Health plans